before we're starting, how are you?
I-
Seriously.
I'm I'm actually great. Yeah, things are going well.
Well, I'm glad to hear it
Yeah.
because
Unlike some people, I'm actually pretty optimistic about how things are going at the moment. So there you go.
oh, we're gonna have to. I have to. I wrote that. I'm gonna have to write that the optimism because I gotta tell you, Martha, I have been the opposite of optimism. It's just been kind of like this nonstop, especially when you're active on social media, braid of negative news and concern. And so
Yeah.
I am very keen to hear about your optimism. Um,
So you're right. I mean, what's going on in the media is kind of incessant. And it's almost like we're so addicted to bad news that we just can't see our way through to the fact that in Canada, anyway, we're in a remarkably good position, even with Delta. So I'm hoping that as time goes on and we realize that we're actually in pretty good shape, that perhaps we'll get a better tone into the media.
I love it. I love it. Okay. We might as well get started. So,
Okay.
Qualcast Nation, we have an honored, like we're so honored to have Dr. Martha Fulford as a guest. I've been really keen on having her on the show for so long. And, we just honestly felt like there's no time like the present. Before doing that, I'll tell you quickly about Solving Wellness, our new online initiative to address physician burnout. Those that are watching on Facebook, if you type in SW, you'll get a link to that. And this is our way of addressing burnout through physical activities, through online workouts, yoga, cooking classes, nutrition tips, sleep advice, cognitive behavioral therapy, mindful meditation, all in one setting, all in one community. First month is free. Sign up today. You won't regret it. Okay. Listen, our honored guest today is Dr. Martha Fulford, and she is a infectious disease doc, really focusing on the pediatric population, works at McMaster's Children's Hospital, and has been, and I say this, I don't say this lightly, Martha, you've been like a role model to me in terms of how to do the right thing, advocating for our kids, not shying away from difficult circumstances when it comes to articulating these things, whether on social media or mainstream media. So I tell you, she's been my go-to when it comes to some of these topics that we're going to address today. So Martha, thank you so much for joining me today.
Well, thank you for asking.
100%. All right. So actually, I'm going to go a little bit off script. You started off when we went on saying you have reasons to be optimistic in terms of COVID in general, maybe in regards to our kids. What did you mean by that?
So, I mean, it's always, I think it's hard sometimes to take that step back and try to say, okay, what were we trying to get to? What's our objective as a society? And the big fear, and I know it feels like it's been going on forever, even though it's actually only been a year and a half, was to ensure that we got through the pandemic phase of this virus without completely overwhelming the healthcare system. It's been kind of touch and go. I think we all agree at times. And it's this complicated situation where the virus goes from what's called a pandemic to an endemic phase. We see that actually with all the influenza viruses, that once we've got enough immunity in the population, it becomes a background virus. And we're lucky in Canada. We have a remarkable vaccination rate. And that, I mean, vaccines it's not going to make COVID go away, but really the numbers are astonishing when you look at how well it is protecting against severe disease. And that's really, we're in a position where we are very lucky that we're going to see numbers go up. Yes, I think it's here to stay, honestly. I think it's going to be one of our circulating viruses. But the amount of severe disease is going to become a lot more like a background virus, like any of the viruses that we deal with on a regular basis. I think we still have a few bumps in the road, but I actually think in Canada, we have remarkably strong vaccination rates, and we're seeing that already. Just look at our numbers in terms of who gets hospitalized. So I feel optimistic from that perspective. Yeah.
I love it. I mean, these are really good points. It's, you know, I think what we hear often in the media is decoupling or defanging the virus. The
Yeah.
fact that our our vaccines are so effective at reducing severe disease. Um, and in your mind, like I know what the answer to this is, but I'll just toss it up. In your mind, what about Delta? What about this
Yeah, the
new,
infamous
that
Delta. Yeah.
infamous Delta? Does
Yeah.
that change anything in your mind?
No, it is more transmissible. I don't think anybody's going to argue that. We are maybe lucky that we're a little bit behind other countries in terms of the Delta wave. So we can look at what's in the United Kingdom and in the United States. In the US in particular, we can compare areas that have got high vaccination and low vaccination rates. And what is very clear is that the vaccines are making COVID go away, and that's not a surprise. But it is very clear that even with Delta, we're not seeing more severe disease. We have a huge denominator, so more people are getting it, particularly in unvaccinated regions. I mean, it's I'm always a little bit uncomfortable with some language because I'm very much against any kind of language that might invoke blame or shame or anything. But COVID is turning into an infection where the severity of illness is seen in people who are unvaccinated for the most part. So, I mean, any of us could still get COVID, but somebody who is vaccinated is going to have maybe no symptoms or very mild symptoms, and somebody who's unvaccinated, unfortunately, is still at risk for more severe disease, particularly the people with the comorbidities, which is age, obesity, hypertension, uncontrolled diabetes, all of the things we've been talking about for a long time.
Yeah. So basically, the key thing is vaccines work at the major impact in terms of reducing hospitalizations and death, but it certainly is more transmissible. And I think that's quite apparent in the literature from what we're even seeing as frontline medical staff. So I think that's an important message.
Yeah, and I think we're seeing it in Ontario. Of course, recently changed how we're reporting, and I'm actually really pleased that we're seeing this,
so good.
Where we're now looking at hospitalizations, because the total case counts are really going to become increasingly irrelevant. Because if what we have are a lot of really mild cases in the community, that is simply not as important as whether or not we're seeing people landing in hospital and actually having severe outcomes. So it is this decoupling, and so our switch in reporting is actually acknowledging that really at this point, the cases are not going to be anywhere near as relevant as the degree to which we're seeing an impact on the hospitals and whether we can deal with that impact.
I don't know about you, Martha, but when I started to see that, like when I first started to see that reporting, I almost got chills. It was like, people are decision makers are seeing what we've been preaching. The fact that there is that decoupling, and as you're going to see these case counts go up, yes, there's going to be a relative increase in hospitalization, but that ratio has changed because of the vaccines.
And that was seen unequivocally in the United Kingdom because, of course, they've had their huge Delta wave. And a lot of it happened after they got rid of a lot of their mitigation measures. So, I mean, in the UK, they pretty much opened up, right? And the wave of Delta was huge. I mean, it was very high, but if you look at the curve for the hospitalizations and the deaths, it went up a bit, but nowhere near what we would have seen pre-vaccine.
It was striking, actually. Like there's a few places that have shown similar patterns, but that spiking case and that the not seeing that relative rise in hospitalization was so encouraging. And their Freedom Day, if I'm not mistaken, we're talking 4 weeks ago, July 19th, something like that. And so we're approaching 4 weeks. 16. Thank you. We are. And the fact that they're not being overwhelmed is highly, highly encouraging.
It is.
And so were you going to say something?
I was going to say, this brings us to the kids.
I was going to say the same. We're jumping in at the same time. But so Delta and kids, I got to tell you, Martha, it's been like when you look at mainstream media, it is, I don't even know where to start. It's like
hysterical.
Yes, it's like I feel like we're losing our minds a little bit. So without putting my judgment into this, with our current vaccination campaign, the fact that we don't have 11-year-olds and younger being vaccinated, what is your overall impression about the risk to kids, specifically when we think of Delta variant and so forth?
Yeah. And again, this is where I think it's really important to take that step back and just like not the Delta, let's just take that step back. So COVID, one of the undersold, if you ask me, good news stories about COVID was the degree to which actually spared children. Not that kids can't get it, but if they do get it, the vast majority are either completely asymptomatic. In other words, it's so mild in kids that have no symptoms, or mildly symptomatic. There are a very small number that do get sick. And a lot of them are kids who are already fragile in terms of their health. They have what we call comorbidities. And these are children who are always vulnerable and that we always need to protect. But the reassuring news was that, and is, that COVID it doesn't cause severe disease in kids. Now, if you have a huge number of children who are susceptible, then there's still going to be that small number that gets sick. And then this brings us to Delta. And so there is a lot of panic headlines at the moment, and it's really kind of annoying, actually. So well, it is, because there's no context. And so there's, for example, hysterical, and I'm going to use the word hysterical because they're really, really very fear-mongering type headlines that pediatric hospitals are filling up. What does that mean? What are the numbers and what are they filling up with? And so I belong to something that's called a Pediatric infectious disease listserv. And so the question went out on our listserv to all the pediatric infectious disease physicians who are there, and it's a huge number of the US physicians. What are you actually seeing? So in Florida, which is one of the states that does have a big Delta wave right now, they are seeing more children being admitted, but the absolute numbers are actually low. So it's not like they've got hundreds and hundreds of children suddenly being admitted, particularly when you consider the denominator. And so the increase in the admissions is very much a reflection of uncontrolled community transmission. So not that it is more dangerous to children, but when you have a lot of transmission in the community, kids by definition are more likely to get it. And one of the things that's very important when we look at kids is who are kids most likely to get the COVID from? And it's actually the adults around them. This is one of the interesting things about COVID that was different from some of the other respiratory viruses, is that while children can transmit it, they're actually less likely to transmit it than an adult. And so a lot of the transmission routes, when we actually do contact tracing, it's adult to child. And so in a community where a lot of the adults aren't vaccinated, by definition, you're going to have more circulating virus and you're going to have more kids exposed. And so what we're seeing in the provinces, in the states where there are a lot of pediatric admissions, it's a reflection of a very large denominator. And so the message is exactly the message we've been giving in Canada, which is we need to control community transmission and we need to ensure that we have as many adults as possible vaccinated, because if the adults are vaccinated, the kids are protected. And this, then if we turn from the US, where a lot of these alarming headlines are coming from, and we go to the United Kingdom, where they've also had a big Delta wave, but they have a much higher proportion of adults vaccinated. What they did not see, they did see some increase in hospitalizations, but it wasn't the surge. It wasn't this catastrophic illness of children. It was exactly the same, actually, in terms of the proportion of children that get severe disease is the same. It's not more with Delta. So our job to protect our kids is actually what we're doing already, which is making sure all the adults around the kids are vaccinated, because the adults don't have the virus, or if they're shedding a very small amount of virus, the kids are essentially protected. And that's knowing that our children are already at exceedingly low risk of a bad outcome. But, I guess, nobody really wants a lot of COVID circulating these days. So
there's so many gems, many key points, and I'm going to try and summarize and you let me know where I messed up. Most common transmission adults to kids. The
Yes.
more that our adults are vaccinated, the more protective it is to our children. And what we're
Correct.
seeing in the States, like for example, Florida, is the proportion, like the percentage of, I guess, would it be like hospitalized? The percent
Yeah, so
hospitalized is
yeah,
similar
so
to,
the absolute risk remains the same.
right. It's
So
just,
it's a
yeah,
low risk,
it's low risk,
but
but the more people that are
larger
infected,
denominator.
you're going to have a larger denominator. Do you have I don't want to put you on the spot. Do you have a sense of how large that denominator is? Okay.
No.
All right.
So
So
because the denominator all basis on how based on who gets tested and how accurate the testing is, and so the denominator, and also of course how many people are asymptomatic versus mildly symptomatic. So it's a very complicated situation, figuring out true denominators.
No, fair enough. I guess my question is like that I've had trouble isolating is how many kids are actually getting sick relative to before. Like I don't want to put you on the spot if this is you know what I mean? If that was,
I don't think I've seen a good sense of that. There are some places that have looked at serology already, like the antibody levels, to try to figure out how many children have actually had COVID already. And the reason it's hard is because so many children have zero symptoms.
mm-hmm. Yeah.
And so if you're asking, the total number of kids, a child who has like no symptoms at all could have had the virus in his or her body and actually developed antibodies and never gotten sick. Right. And so it is a bit of a challenging situation with children because it is so mild in most of them. But the what we're seeing coming out of the UK and the early data from the US, when you actually sort of take that step back and try not to get sucked into the the sort of more fear-mongering type headlines, is that the actual numbers, the absolute risk remains the same. And so what we call infection fatality rate, so the risk of a child dying of COVID is not higher anymore than it was before, and it remains exceedingly low.
Yeah, this was one thing that I saw. I forget where I saw the reference, but even when you look at UK alpha variant or the UK variant versus the Delta variant for kids, that's this percentage hospitalized was similar, implying that Delta is not making our kids more sick or more at risk of dying. But as you mentioned, it is more transmittable. So the more of us that are protected in the community, the more we're protecting our kids. And that makes me think, we've been seeing a lot of, I don't know if you saw that tweet by potentially an esteemed colleague, but basically showing tons of concern that our youngins, like the 0 to 11-year-olds, are not being vaccinated going into a school year. What is your general thoughts about the risk for the youth?
I really don't understand what the hate for schools that we have on. So this whole schools being safe, our kids being safe, and I always say, okay, but safe from what? So we know that they're actually not at risk of severe disease from COVID. So, I mean, we all want our children safe. And so if you want to ask, what is the single safest thing for a child? Obviously, and for me, it's all aspects of what a child needs. It's their physical health, it's their social health, it's their mental health. It's integrating all of that together. And what is the single most important, sort of safety issue for our children? And so when we come to COVID, despite all the really quite negative media, particularly in Ontario, where we've had the longest school closures anywhere in Canada, we actually have not seen a lot of transmission in our schools. And there's lots of causation or sort of correlation versus causation graphs. People put it all up. People just don't believe the numbers. But even in Ontario, if we look at the numbers that we had of actual in-school transmission, it was less than 1%. That means that the vast majority of the children who were testing positive for COVID were actually getting in the community when the contact tracing was done. Now, some people are saying, oh, that's because we didn't catch enough or we weren't tracking enough. But similar studies have been done in other jurisdictions, and in fact, pretty much everywhere in the world. We can look at British Columbia, we can look at Sweden, we can look at Scotland, we can look importantly at the United Kingdom. And I'm going to come back to the UK in a sec. And what we were not seeing was a lot of transmission in schools. In other words, being in a school actually had a lower risk of getting COVID than being in the community. And it's probably because it's a controlled environment, because, you know, the kids are sort of in defined cohorts, because it's not like kids disappear off the face of the earth if they're not in school. They're off doing other stuff. They're off getting exposed in other ways. And so the fact that being in school had a lower risk of getting COVID, I think is kind of important. And then if we sort of think, okay, but maybe it's because the kids were asymptomatic and it was all sneaky asymptomatic transmission. So then there have been some really good studies now to look at whether teachers were getting COVID, because the issue with safety in schools is partly, are kids safe? And I would say from COVID, the answer was absolutely yes. But then of course, there are other people in schools, like our adults, that's a hugely important group of people, obviously. So were teachers more likely to get COVID? And there was a lot of fear about COVID, a lot of concern, obviously. But a year and a half into this, we have a lot more information. And so there is a study from Sweden, and Sweden's a good example because that's a country that actually chose to never have hard lockdowns and never had things like, and still don't have mandatory masking, never had mitigation measures, that kind of mitigation measure at school. And they actually looked at the risk of people in the population getting COVID by profession. And school teachers at all levels were at essentially exactly the same risk as the community. In other words, by being a teacher in a school with a whole lot of children, none of whom were masked or doing physical distancing, teachers were not at higher risk. That was Sweden. Exactly the same thing was found in Scotland. Exactly the same thing was found in the United Kingdom. And then if you think, okay, but those are outside, what about Canada? Well, we have a really good study from Vancouver where they looked at the school district in Vancouver, and they actually did the blood work on the teachers, so serology, to see if they had any evidence of exposure, so looked at their antibodies. And whether it be elementary school or high school, teachers, by virtue of being in the classroom, were at no higher risk of having had COVID than the average adult in the community. And this includes elementary school teachers. And the reason I say this is because British Columbia has never actually required masking of young children. And of course, they never shut down their schools from September of last year. So their schools were open the entire year. And despite all of that, teachers were at no higher risk. And then with Delta, so we come to the final, big question: is Delta going to change this? Well, obviously it's kind of early in Canada because we're just at the beginning of Delta. But a study that just came out, or an observation has just come out actually in the British Medical Journal yesterday, so it's hot off the press, shows that when they looked at the rates of COVID in students in the United Kingdom who are in school open with Delta, I've got the numbers right here. So students in the month of May and June, their numbers were really low, less than 1%. And in secondary schools, 0.27% of staff tested positive in June, and that's with their Delta. So in other words,
students and staff, or sorry?
That was a staff was 0.27%.
Okay.
And students were about 0.42%. Yeah, less than 1. It was 0.2%. An increase with Delta of 0.05%. So these are just, they're numbers, but the message, the overwhelming message is that schools have not actually been amplifiers. They reflect community rates. So if community rates go up, you're going to see parallel rates go up in schools. If community rates stay low, schools have been shown to be safe. So not that there's ever going to be zero risk, and there's no zero risk scenario. And of course, with the exception of the British Medical Journal one, which includes post-vaccination, all the previous studies were before we had vaccines in the community. So the concern about the children, even though the children themselves are not at risk of COVID, of course, one of the concerns was also, are the teachers at risk? But also, are they going to bring it home to vulnerable family members? With adults vaccinated, any adult who chooses to be vaccinated it can be vaccinated. I mean, there are really no barriers anymore in terms of if you're interested, we should be able to find a place and get vaccinated. Dramatically, like well over 90% reduction in severe disease and hospitalization or dying of COVID. So we have a situation which is very reassuring. So that's sort of the safety side from COVID. Excuse me. But the thing is, it's not just COVID, of course. And I'm going to come back to what I was saying earlier about what do we want for our children? What is the safest thing for our children? And of course, it's not just COVID. We have seen an explosion of what I'm going to call collateral damage. We have had doubling and tripling of children admitted with eating disorders. And this sets them up for lifelong health problems, of course. And that's the tip of the iceberg, because these are the kids who have actually ended up being admitted to hospital. We've had unbelievable increases in mental health and anxiety problems. We have had, at least at our hospital, an increase in severe suicide attempts. And that also means longer hospital stays. There are, on the other spectrum from the eating disorder, we have an increase in obesity. And this is, of course, because our kids aren't going to school. They're not playing games. They're not allowed to have physical activity. Sports were shut down. And obesity is not just a risk factor for severe COVID, but that also sets up for a lifelong, a lifetime of health issues, and will almost certainly have a decreased life expectancy. And we all know this. I mean, it's not a secret. But there are other benefits for our children of school. It's play. Play is a hugely important part of early childhood development. Play and interaction and learning how to get along with other children, as well as interacting with our adults. All of that is incredibly important for the long-term development of our children. It's time when they have friendships, where they develop relationships, where they learn to become adventurous and explore the environment. It is what allows our children to become fully functioning adults. So all of these other benefits of school you cannot dismiss, not to mention, of course, the utter and critical importance of just education, because education is probably the single most important thing to predict success for a lifetime success for the students. And so when we're balancing our conversations about safety for kids, we have to multitask. We have to think of all of these things, and we have to be reassured that COVID, fortunately, is not a very dangerous virus for children, and really probably no more dangerous than a lot of other viruses we deal with all the time. For kids, it was a very different story for adults, but because we're in this very fortunate position in Canada and Ontario, we've been able to vaccinate our adults really aren't at higher risk anymore. So this really means that we simply cannot ignore the collateral damage. I'm just going to give you an anecdote. I was looking after a 13-year-old in the hospital. She was in for an unrelated reason. She was very withdrawn, very lethargic, just really not very interactive kid. And I asked the mother, is she okay? Mother says, oh, she's just a pandemic kid. I thought that was one of the most tragic comments I've ever heard, that you're writing off this child's complete withdrawal from interaction as a pandemic kid. That is not okay.
It is absolutely not okay. And as you alluded to, a lot of these things carry over to future years, potentially generational. And I got to tell you, I'm a little emotional thinking about what you were saying about play, because I think of my children. So those that knew the show, I got three kids, and I got to tell you, so my recently turned 3-year-old, when the first time we went to daycare, and realized that he didn't have to distance from people and got to have a genuine interaction, you should have seen the shift. You should have seen the glow. And then our kids, after we dealt with obviously school closures from April on, and then when they start to go to camps and that apathy, and like whatever you want to label as, when we talk to our child psychologists colleagues, it's like that's the number one thing, that no motivation, that apathetic tone, that is not benign. And I got to tell you, Martha, one of the things that I don't know if it's the background of being an intensivist or doing like cost benefit analysis, but when you choose an intervention, there's like when if it's medicine, if you're an engineer, whatever it might be, you think of the collateral damage. you factor that into your equations. You not only to plan for it, but to help mitigate it, to realize, is the cost going to be worth it? Is the benefit going to outweigh the cost? And the fact that we weren't having these conversations, the fact that even it was taboo to have these conversations as early as the first wave, was ridiculous. And I do not, like, I got to tell you, and this is why Martha's one of my heroes, because there's a handful of us that will speak to this stuff. And like, you'll see, there are hundreds of docs, thousands of docs that feel the same way, that are like, man, we really have to have balance. And because of the nature of, I don't know how this developed, it became unsafe to speak. It became unsafe. And so, like, she stepped up. She's one of many that stepped up, because I'll tell you what it is. It's a sense of duty. It's a sense of looking at your kids and saying, am I serving you well right now? By standing on the sideline saying, hey, yeah, school closures, despite the myriad of evidence saying that it's safe, the incredible vaccine rollout, that I'm going to sit there and say, like, oh yeah, well, you know what, this is what it is. I'm going to see my apathetic kid and say, that is okay. No. And one of the things that I hope every time we do one of these things is to encourage the docs out there. Like, yes, it is scary to rise up and articulate your concerns, but it's necessary. It is absolutely necessary for our kids. And if you can't stick up for kids, I don't know who you can stick up for.
March of 2020, I think, fair enough, we didn't know what we were dealing with, but it was pretty rapidly obvious that kids were not at risk. And this, to me, was, I keep saying, it's one of the unacknowledged good news stories of COVID. Like, I don't understand why we're not celebrating the fact that it essentially spared young people. I mean, this is unbelievably good news, because the next pandemic could be a lot worse. I mean, influenza tends to be a lot more severe in young people. So, I mean, my approach has always been what I call total harm minimization. I mean, clearly COVID is here. I mean, nobody's going to deny COVID. It's very severe, and it's particularly severe for vulnerable adults and for our seniors. And so our policies should have policies that protect our seniors, that protect vulnerable adults. We should be focusing in on not just how to, well, I mean, I'm very pro-vaccine for our seniors, make no mistake, but also other lifestyle interventions. I know you've been on this a lot, but obesity is a thing. Now, I don't know if I'm bouncing right now, but I'm on one of these sort of, balls that you have to balance all the time. Yeah,
I'm a stand-up desk, yo.
Yeah, exactly. So I'm on. So there's lots of things to do, but these are really important measures, and so that's on the adult side. But total harm minimization for children was a very different conversation. So our policies and our strategies and what we needed to do in order to protect our kids was very different, because they didn't need protection from COVID as much as they needed protection for the collateral damage. I think anybody who works at a pediatric hospital is going to say what we have seen in our hospitals has been collateral damage. Sure, yes, of course, we've had some children admitted with COVID, and these are particularly very vulnerable kids. But if you look at the numbers across Canada, they're not high compared to a lot of other things we deal with all the time. And COVID as a risk to children is still a lot lower in terms of mortality than suicides and overdoses, quite frankly, or car accidents or cancers or any other series of things. So I mean, these are easily available numbers. Anybody can look them up to look at the actual risk of COVID versus all the other risks that we deal with all the time. And so, but it's a very complicated message to say we have to balance what we do. So we protect our children, we do what's best for them, we do what's best for working adults, and we do what's best for seniors. And that, to me, is what public health and what our focus is total harm minimization. Acknowledging COVID is here, but if we end up causing more harm and we have more deaths and more long-term damage because of our measures, well, then we've done something very wrong. And I worry that we sort of lost that balance, that our focus on COVID has been so intense. And And I'm sorry, but some of the headlines are wrong. Like the headlines shouldn't just be about COVID, but they should be about the collateral damage. They should be about what the cost of all of this is. And not to deny COVID, but all this stuff on kids and all these headlines about Delta and kids, I think the headline should also be mental health and eating disorders and educational interruption and what we've done to the long-term social development, the social emotional development of young children, because these are equally and maybe even more important when we're talking about our kids. And so it's finding that balance that I'm advocating for.
Absolutely. It's just, I can't believe how, I don't know, the messaging has been just so all over the place. Like I still to this day, I just as an example, because you were going into the exercise bit, like someone on Twitter asked me if I've seen a young, healthy person in the intensive care unit from COVID. And I'm not saying it has never happened in the world. The question was asked, have I seen one? I still haven't seen one. And like, even when people in the headlines and during the UK variants, 20 and 30-year-olds, what they still weren't talking about was a lot of them were above 300 pounds, like that I seen personally. And so like this has to be part of the narrative. It has to be like, what is your realistic risk? What are the true, like, because to me it's almost like a not deflection, it's like a, what's the word, distraction, sorry, about like who really needs to worry about this and why, like where the true risks are. And so I think we did the public a disservice.
Well, it's what some of us have said, there's no context.
That's a good way of framing it.
And I also, I know some of my colleagues have referred to it as medicine by anecdote. So you'll have like one terrible story that suddenly hits all over the media. And I'm going, but that's not what's really going on the ground. And if it's 1 out of 100 million, because I guess in the US, because some of those worst case scenarios, these sort of tragic stories, and it seems to overwhelm the narrative. And then what's the context? What were the risk factors? What was that person doing? And what is the denominator? And so the perception of risk that people have is just far higher than the actual risk. And I don't actually know how to fight that. And people are terrified. And I mean, I've been advocating for kids all along, because that's, I think, where I decided this was the hill I was going to die on, so to speak, was advocating for our children. But there's also a huge mental health issue with adults. There are some very, very traumatized people out there that there's going to be a long recovery.
Oh my God. I mean, I still, judge me for this if you want, but I'm still seeing people walking on the street, like masked outside. I'm saying outside masked and still doing I'm scared to get Delta from you. And it's like, like if we think about that level of anxiety that someone's walking with on a day-to-day basis, that's not healthy. I could tell you, whatever they teach you in school, whatever you want to Google, it is not healthy to be walking around with that level of anxiety all the time, thinking that you're putting your life at risk, taking a walk outside. We're not serving our public well.
No. And this does bring us to the kids again, because outdoor activities are safe. And I mean, we really haven't shown, and there have been some really good studies trying to see if there have been transmission with outdoor activities. And again, it's balancing that I sound, I mean, it's hard to believe, but there is more to health than COVID. And I say that because of our just really, obsessive reporting and appropriate at the beginning attention to COVID. But our kids and our youth, if we're worried about their safety and if we're advocating for what's best for our children, what is best for our children is school, it's education, it's social interaction, it's all those extracurricular activities that allow them to develop into like a fully functioning adult. And it's balancing all of those. So I've struggled when people are so concerned about COVID that they're not actually seeing what's really happening to our youth. and the harms. Clearly, there are some children who are more vulnerable. And I mean, this has always been true that we have had very vulnerable children every respiratory season. We had very vulnerable children during the 2009 H1N1 pandemic. And it's in no way to in any way deny the fact that there are some vulnerable children. But we're creating a generation of really damaged kids by not actually allowing them to have a normal childhood. It's something I've said before, which is kids need to be kids.
And there's so many levels to that too. Like not only their psychological, their overall development, physical development we've impaired, but like think about this debt that they're gonna have to take on. Like our kids, like the ability for them to afford a home in years to come. Like it's insane how we've just really hit hard that generation.
And of course, I mean, the worst damage, of course, are the kids who are already vulnerable. These are, the kids who are already marginalized, who might have already been struggling. That's where the most harm probably of all. And then there's another group of kids that I've hardly seen mentioned anywhere, which are what I think of as the lost kids. The estimates for Ontario are that we have about 100,000 children who are just gone from the school system. These are kids who are so disenfranchised, and it's not because they quit school, but these are kids who have difficulty with online access. Maybe they're in an apartment and they're trying to share their device with 4 or 5 other siblings. These are the kids that maybe what was keeping them in school was their sports or their music or their drama, their peers, their friends. And quite frankly, nobody likes sitting in front of a screen all day long. This idea that somehow online learning replaces in-person learning and human-to-human interactions, sure, for a month or two maybe, but not for 2 years. That's 100,000 children. I mean, we don't even have a good sense of the numbers because we're not tracking, and that's just in Ontario. I'm not even talking about all of Canada. In Ontario, that's what we're thinking we're dealing with. How do we even find and reintegrate those kids? Those kids aren't at risk from COVID, but their entire future is now destroyed if we can't get them back into an education system, to something that will allow them to become fully functioning adults. That is huge, 100,000 kids. And these, you simply can't ignore this.
It is massive. And like, listen, that's legit too. Like we, with our Bridges Over Barrier charity, like it was launched because of this, because of the kids that were being essentially lost and that were barely making ends meet. And the needs were massive. Like I remember just an anecdote where a family is choosing between diapers and feeding their kids. Like it really was like that level of hardship, and trying to find to follow through with online learning. Like that's a pipe dream. And so like our social workers have clearly stated that we have lost children. We don't know where they are. We don't know, and like, so this is a real narrative. And I'll tell you straight up, a lot of them are racialized. They're already like got the chip stacked against them, if that's an expression. I mix metaphors all the time. But and once again, it's just one of those motivators to say, like, you know what, we need to do the right thing. We need to step up for those that can't step up for themselves. Couple things that sorry, go ahead.
I don't know if you're going to touch this, because one of the things that's also all over the place right now is this thing called long COVID. So I don't know if
I'm telling you, Martha, you're like reading my plasm. Like there's a couple things that the long COVID, I wanted to talk on RSV and masks in general with our kids, but so like the long COVID one is a good one. It's a good one.
So I'm going to call this a post-infectious syndrome. And the reason I'm calling it a post-infectious syndrome is because we deal with these all the time. So anybody who does pediatric infectious diseases or general pediatrician will have seen a child who gets something after their acute infection, or an adult, actually. It's not just kids. And there are some that are very well recognized, like Guillain-Barré syndrome. There's something called ADA. There's things that we recognize as happening after infection. And another common one actually after bacterial infections is actually streptococcal, like rheumatic heart disease. So we know that post-infectious syndromes happen. So COVID being a virus, I don't think it's a surprise that we're going to see post-infectious syndromes. The question is, what does this mean and how frequent is it? And again, it's this sort of mass of just anecdotes and really, I'm sorry to say this, but unvalidated information. And in order to figure out, okay, how many people truly have this, you need control groups. You actually need to say who's had COVID, who hasn't had COVID, and are the people who've had COVID more likely to have a to have a problem, and not just base it on every kid or every adult who feels bad, because you know what, a lot of us feel kind of lousy. Well, I was starting feeling kind of optimistic, but so maybe, but there's still, like we're talking about, like very, very frightened people who've had not been allowed to have social access, who've not been exercising, who've not been allowed to do a lot of their normal things. And it's not just exercise, but for people who main community was their church group or their choir group or their bird watching group. These are interactions that we've cut off for a lot of people, and that causes harm. And so how do you tease out real post-infectious with this whole lot of other stuff? And so for kids, because that's what we're talking about, there have actually been studies done, and there was one that had a smaller group, which is they looked at 1,355 kids, and this is blood work. And this is important because serology tells us that the person actually had the infection. So you're not guessing, you're not trying to decide, some people think they had it, but maybe they did, maybe they didn't. And they found that, yes, there was maybe around 2% of the kids had true sort of post-infectious syndrome. But the good news is that by 12 weeks, they were essentially all better. So not to minimize the fact that some kids had post-infectious syndromes. The interesting thing was that 2% of the kids who'd never had COVID also felt bad. So that's the comparison, right? But even more important is the study from the United Kingdom. And again, the UK is good because they're kind of ahead of us in terms of their waves. And they actually did a huge one where they looked at data from, and I'm going to read you the number, 258,790 kids, age 5 to 17. And then they looked at prolonged post-infectious symptoms. And they found, and it's probably they only were able to look at the kids they looked at kids who had symptomatic COVID. So that were symptomatic. So a child who had no symptoms wasn't there, and compared them to the kids who didn't. And 1.8% of the kids with COVID had post-infectious syndromes compared to 0.9%. So in other words, just under 1% actually has something that could be attributable to COVID. Is important. So it's not to minimize long COVID, because there are children who get post-infectious syndromes, but the reassuring thing is the numbers are low. The reassuring thing is that they were self-limited. And the reassuring thing was that they were, for the most part, really mild. And so again, it's how do you balance this situation? Because there's always going to be the one or two situations where you have somebody who has a really severe post-infectious syndrome. We see some really bad post-infectious things after influenza, for example. So they happen, but what we can't do is, again, have one really bad story and then attribute it to everybody. And it's very difficult right now because there's so much emotional overlay. And I actually said this in another conversation. I got accused of gaslighting everybody who had long COVID. And I was thinking, no. I do believe there are post-infectious syndromes, but I also believe we have to be very clear what we're dealing with, and that we don't just have every person who feels depressed and lethargic and short of breath because of a lot of social circumstances that labeled, because labels are important. So we have to know who really has it. And fortunately, if we look at the studies that have good control groups, the risk of long COVID is low.
Really reassuring, absolutely reassuring. For me as a dad, like the fact that they seem to be mild and like not forever.
Yeah.
They a relatively short period of time that the symptoms resolve.
Yeah.
Okay. The other
and the UK is important because they've had the huge delta, so they have a very large denominator and database that they can look at, and so that's why I think Delta and kids in the UK are probably not that different than Delta and kids in Canada. So I find that really reassuring.
Love it. What were your thoughts when you there were the headlines of what was going on with RSV in New Zealand? So the thought was, just for those that didn't see it, they were seeing a surge in RSV, a common virus that's seen in our kids. Almost all kids will be exposed to it. It does cause hospitalizations, but they saw a surge in numbers. I don't know if any thoughts came to mind when you saw that.
So RSV stands for respiratory syncytial virus, and language. It's one of the common circulating viruses. We see it every year, but it's usually considered a winter virus. It's normally one of the ones that's one of our many seasonal viruses. And we usually see a surge at some point in the winter. It's most dangerous to very young kids. And we do every year have kids admitted to hospital, including the intensive care unit, because of what's called bronchiolitis, and RSV is a common cause of this in young children. So it is actually potentially a severe disease for a small subset of kids, but kind of like a lot of viruses, for the vast majority, it's not that dangerous. What's interesting is that we've seen, I'm going to say our viruses are kind of out of sync. And so the normal seasonality seems to be all over the place. And so the New Zealand saw a spike. And was this because of, maybe they had been protected and now suddenly it was out there? Or was it actually that we're paying a huge amount of attention to viruses in kids and testing a lot more? Because of course, in the past, you wouldn't necessarily test every child with a runny nose. And so are we getting like a false denominator? But the US has seen this as well. They are in fact seeing increases of RSV admissions. And this is in the summertime. So it is an odd time. And I'm not going to, I can't actually speculate on all the reasons, but it is a bit of a concern. It's a bit of a concern that we might see what we might also think of as a double cohort of kids with RSV, because a lot of the kids who didn't get it last year might get it this year. And fortunately, again, it's one of the many viruses that most kids get. And it's not wrong for a child to get a virus. I mean, childhood illnesses are childhood illnesses. They're not by and large dangerous, and they are part of our building, a robust and sustainable immunity to protect ourselves from all the things in the environment, because of course we're not in a sterile world. But RSV is contributing to some of the hospital admissions in the US. And it's very difficult sometimes to tease out the reason why somebody's hospitalized, because both in Canada and the United States, anybody who's admitted to hospital who tests positive for COVID is counted as a COVID admission, even if the reason for it maybe was appendicitis or something else. And because we're screening everybody going into hospitals, we are finding a lot of asymptomatic people so the reason for admission is even in COVID. And so it becomes a little tricky, because you might have a pediatric hospital that's overwhelmed, but the actual number of COVID cases is low. It might actually be that they're overwhelmed because of collateral damage, because of misdiagnosis, because of trauma. I don't know, right? But I just, and again, this is where context is so important. So that if you see a headline that says pediatric hospitals are overwhelmed, okay, but how many is it because of COVID? Is it because of RSV? Is it because of delayed care? And so these are shades of gray, if you want to think of that I think are really important. Again, not to say that we can ignore COVID, because clearly we can't, but this whole mix of viruses is going to be, and it's going to be very challenging actually as we move into the fall, because we are going to start to see some of the other normal viruses. We have, on any given year, we always see influenza, we always see RSV. I'm going to come back to influenza in a sec. We usually have 4 circulating coronaviruses. So part of our normal seasonal respiratory viruses include 4 coronaviruses, human coronaviruses. And I think, along with some of my colleagues, that COVID will become the 5th circulating coronaviruses when it moves into sort of this endemic phase. But we're going to have, it's going to be challenging, because most runny noses, I bet, aren't going to be from COVID going forward. And so it's going to be a little bit of a shift, I think, in mindset and how we deal with this, because as we all know, kids get colds pretty much all the time, particularly their first year in kindergarten or in grade 1. And so balancing, the health of our kids and allowing them in school is going to have to be, I think, at some point, that step back and saying, well, these kids have mild disease, they can be at school. It's an evolving story, and clearly we're learning as we go along. I think clearly I think we're all advocating for our kids to be in school. It's by far and away the most important thing for our children. So if our focus is the health and well-being of our kids, they go to school. That full stop. But how we deal with COVID and how we deal with COVID is going to be a lot of our mindset. And this is where this decoupling is so important.
100% agree with that.
Yeah.
It's going to be a mindset shift. Um, we're just at the hour, so
Oh, yep.
we gotta unfortunately sign off. The in 2 minutes or less, if that's okay, Martha. Why have you?
Yes.
What has motivated you to be a voice? What has given you the courage to speak up against some of the lack of balance that you were seeing?
I couldn't, it was pretty clear pretty early on that what we were seeing in our hospital was collateral damage. And so that to me is, wait, we're doing more harm to our children than COVID is doing. And so I'm thinking, okay, we're in a situation where kids and adolescents are at low risk. We have to put their health and well-being number one. And I guess, I mean, I think somebody has to speak for our kids. They were not being advocated for in a way that they needed. And it's also been interesting and somewhat disturbing to me that, for example, in Ontario, we have this really, really strong, and I don't even know how to fight rhetoric that schools were intrinsically unsafe. And yet most of the rest of Canada kept schools open with even fewer mitigation measures than we had, and the sky didn't fall. I mean, British Columbia kept its schools open. They didn't even have mask mandates in the classrooms until February. In February, it was really only from, I think, grade 8 up. And then in April, from grade 4 up, they never masked JK, kindergarten, or elementary school. And somehow those kids were able to stay in school. They didn't have a crisis of COVID in their kids. They didn't have a crisis of COVID in teachers. And I guess if you look, for me, it was looking around at everything going on. But the sum of, I mean, I can't give details, but some of the collateral damage, and some of these kids are vulnerable, it was simply impossible to ignore. I mean, we have to do right. Kids are our future. We have to do what's best for their complete total health and well-being. It's their physical, it's their social, it's their mental, and they need their own policies. We need to advocate for our kids despite COVID. And I don't know. I mean, I couldn't stand by and watch what was happening to children and not speak out.
I'm so proud. I'm so proud of all that you've done. Oh my God, I apologize that I didn't touch on this one. Is it possible to do whether you think kids need masks in a short period of time, or do you think it's a too big of one? We can skip it if you want.
Well, I mean, masks are an interesting, and it's like a lot of things, very emotional topic. I think there's a role in sort of, certain crowded, really closed conditions. But again, masks in schools is a tough topic because people are very emotional about it. And I guess, again, I keep thinking, well, can we look at places that had masks, that didn't have masks? And also, can we look at what we're trying to achieve? And by that, I mean, COVID is not going away. Our kids aren't at risk if they get COVID. Our adults are protected. So, if you sort of balance off the pros and cons, I actually liked the document that the Hospital for Sick Children and the Ontario Science Table, which also endorsed it, put out, because they had a sort of a green, yellow, red system, or scale up or scale down.
Beautiful, actually.
Because acknowledging actually that there are plenty of times where we don't have to have masks on our kids or in schools. And this is based not just on case count. This very important thing about that document. It was on severity and hospital capacity. And it was a much more fluid system. So it's not absolute. It's not yes masks, no masks. It's actually, there are a lot of times where it will be okay for nobody to be wearing masks, but we monitor and we keep an eye on things. And so there's no sort of fixed rule. And I liked the scale up, scale down, red, yellow, green system, because right now, for example, we would be in green and we would be in a situation where it'd be absolutely fine for the kids to have no masks out and about. And there may be times where in certain communities in particular, you might just start to see increases. And that was the other thing about it. It was very regional.
Yeah.
So it meant that if you were in a community with like where there's really no transmission, well, then they're in green and they don't have to have the masks. And so it's a flexible, adaptable system. I kind of wish we had actually done that in Ontario, because it allows, well, it's quite frankly, a much more sustainable system. And whether masks work in young kids, I mean, nobody's actually studied it. It's quite fascinating. There are actually no randomized controlled trials of masks in young children. And I don't think I'm alone in noticing that most young kids sort of chew their masks and they get moist and they get damp in their cloths and they get dumped on the ground, they pick them up. And so, I mean, it's a very emotional topic though, and it's one that I try not to get too into, because people get very passionate about masks. But if I had to advocate for anything, it actually would have been the extremely well thought out document that Sick Kids put out, because it had a really nice algorithm for a regional scale up, scale down algorithm, which I thought was pretty pragmatic, actually.
I love it. I love it. I completely agree. Listen, Martha, you are a gem. You are, once again, one of my heroes, one of the people I look up to, one of the people that have given me personally the fuel to continue to advocate for our kids. So I honestly thank you so much for agreeing to do this. Those that
Thank you.
are absolutely, those that are catching this now, if you press NL in the chat box, you'll get a version of this audio email to you. We'll have the podcast out as soon as it's ready, because this is too important of an issue. And thank you, and continue to do what you're doing, and I'll be there right behind you. Absolutely.
And I completely agree with everything you're saying, by the way, about wellness. I've been following that and making sure I do it as well. So
thank you so much. It means a lot. Thank you.
Okay.